The prostate is a small gland in the male reproductive system. It is roughly the size of a walnut. This gland is located just below the bladder. It sits in front of the rectum. The tube that carries urine from the bladder out of the penis, known as the urethra, passes directly through the center of the prostate. Understanding its location is key to understanding some of the symptoms that can arise if the prostate becomes enlarged or develops problems. This small organ plays a very significant role in a man's reproductive health, a fact that is often overlooked until issues arise. Its health is integral to overall well-being for men as they age. The primary function of the prostate gland is to produce seminal fluid. This fluid is a vital component of semen. Semen is the milky substance that nourishes and transports sperm. During ejaculation, the prostate squeezes this fluid into the urethra. There, it mixes with sperm from the testicles and fluids from other glands to form semen. This fluid makes up a significant portion of the ejaculate volume. The prostatic fluid contains enzymes, proteins, and minerals that help protect the sperm and improve their ability to move, thereby increasing the chances of fertilization. Without a healthy prostate, male fertility can be significantly impacted. The prostate does not work in isolation. It is part of a complex network of organs involved in both the urinary and reproductive systems. It works closely with the seminal vesicles, which are glands that also contribute fluid to semen. The testicles produce sperm, which then travel through tubes called the vas deferens. These tubes pass behind the bladder and join with the seminal vesicles to form the ejaculatory ducts, which then pass through the prostate to empty into the urethra. This intricate system highlights how a problem in the prostate can affect multiple bodily functions, including urination and sexual function, making its health particularly important for men throughout their lives. Therefore, understanding this small yet crucial gland is the first step towards proactive health management. Many men are unaware of the prostate's function until they experience symptoms. However, knowledge empowers individuals to make informed decisions about their health. Knowing what the prostate does and where it is located helps in recognizing potential warning signs. It also underscores the importance of regular checkups and discussions with a healthcare provider. Maintaining prostate health is a lifelong commitment. This understanding forms the foundation for recognizing the risks associated with conditions like prostate cancer and the importance of early detection. Prostate cancer begins when cells in the prostate gland start to grow out of control. Normally, cells in our bodies grow and divide in an orderly way. However, sometimes this process goes wrong. Instead of dying off when they should, old or damaged cells survive, and new cells form when they are not needed. These extra cells can form a mass of tissue called a tumor. In the case of prostate cancer, these abnormal cells are found within the prostate tissue. This uncontrolled growth can eventually spread beyond the prostate to other parts of the body if not detected and treated early enough. It is a complex disease with various forms and growth rates. One of the most challenging aspects of prostate cancer is its silent nature in the early stages. Often men with early prostate cancer do not experience any noticeable symptoms. The tumor may be too small to cause any physical problems or press against surrounding structures like the urethra. This lack of early warning signs means that the cancer can grow undetected for a significant period. This is why it's often referred to as a silent disease. Without specific screening tests, a man might not know he has it until it has progressed. This silent period underscores the critical importance of awareness and proactive screening measures, especially for those at higher risk. Several factors can increase a man's risk of developing prostate cancer. Age is the most significant risk factor. The likelihood of developing prostate cancer increases substantially after the age of 50. Most cases are diagnosed in men aged 65 or older. Family history also plays a crucial role. If a man has a father or brother who had prostate cancer, his risk is more than doubled. Having multiple affected relatives, especially if they were diagnosed at a young age, further increases this risk. These genetic predispositions are important to discuss with a doctor to determine an appropriate screening schedule for individual circumstances. Beyond age and family history, ethnicity is another important risk factor. African American men are more likely to develop prostate cancer than men of other races. They are also more likely to be diagnosed at a later stage and have a more aggressive form of the disease, leading to higher mortality rates. Research is ongoing to understand the reasons for this disparity, which may involve genetic, environmental, and socioeconomic factors. Additionally, some studies suggest that a diet high in red meat or high-fat dairy products and obesity might increase the risk. Conversely, a diet rich in fruits and vegetables may offer some protection, though more research is needed to fully understand these links. While early prostate cancer is often symptomless, as the cancer grows larger, it may begin to cause noticeable signs. Many of these symptoms are related to urination because the prostate surrounds the urethra. Men might experience a frequent need to urinate, especially at night. They might also notice a weak or interrupted urine flow or difficulty starting or stopping urination. Some men report feeling pain or a burning sensation during urination. It is important to remember that these symptoms can also be caused by non-cancerous conditions, such as benign prostatic hyperplasia, BPH, which is a common enlargement of the prostate in older men. However, any such urinary changes warrant a consultation with a doctor. If prostate cancer progresses further and becomes more advanced, other more serious symptoms can appear. These might include blood in the urine or semen, which should always be investigated promptly. Pain in the back, hips, or pelvis that doesn't go away could indicate that the cancer has spread to the bones. Unexplained weight loss or fatigue can also be signs of advanced cancer. Some men may experience erectile dysfunction, or difficulty achieving or maintaining an erection, though this can also have many other causes. The appearance of these more severe symptoms often suggests that the cancer is no longer confined to the prostate gland, and may be more challenging to treat effectively. The presence of these later-stage symptoms underscores why waiting for problems to arise is not a safe strategy. When symptoms become apparent, the cancer may have already grown significantly or spread to other parts of the body, a condition known as metastatic prostate cancer. Treatment options at this stage are often more complex and may focus on controlling the disease rather than curing it. This is why the emphasis is so heavily placed on early detection before any symptoms have a chance to develop. Catching the disease when it is still confined to the prostate gland offers the best chance for successful treatment and long-term survival, making a significant difference in a man's life. Early detection through screening is therefore paramount. Screening tests are designed to find cancer before symptoms appear. The two most common tests are the prostate-specific antigen, PSA blood test, and the digital rectal exam, DRE. The PSA test measures the level of a protein produced by the prostate gland. Elevated levels can indicate cancer but also other prostate conditions. The DRE allows a doctor to feel the prostate for any lumps or abnormalities. While no screening test is perfect, these tools, used appropriately and in consultation with a doctor, can significantly increase the chances of finding prostate cancer at an early, more treatable stage. This proactive approach empowers men to take control of their health. While some risk factors for prostate cancer, such as age, race, and family history, cannot be changed, there are lifestyle choices that may help lower a man's risk. Adopting a healthy diet is often recommended. This includes eating plenty of fruits and vegetables, which are rich in vitamins, minerals, and antioxidants that can protect cells from damage. Some studies suggest that foods rich in lycopene, like tomatoes, and cruciferous vegetables like broccoli and cauliflower, may be particularly beneficial. Limiting the intake of red meat, especially processed meats, and high-fat dairy products, is also advisable, as these have been linked to an increased risk in some research. Choosing lean proteins and healthy fats can contribute to overall well-being. Regular physical activity is another important component of a healthy lifestyle that may reduce the risk of developing prostate cancer. Exercise helps maintain a healthy weight, which is crucial because obesity has been linked to more aggressive forms of prostate cancer. Aim for at least 150 minutes of moderate-intensity aerobic exercise, or 75 minutes of vigorous intensity exercise per week, along with muscle-strengthening activities. Even small amounts of activity like taking regular walks can make a difference to overall health. Staying active not only potentially lowers cancer risk, but also improves cardiovascular health, mood, and energy levels, contributing to a better quality of life. Open and honest communication with your doctor is absolutely essential. Discuss your personal risk factors for prostate cancer, including your family history and any lifestyle concerns you might have. Your doctor can help you understand your individual risk profile and make informed decisions about when and how to begin screening. There is no one-size-fits-all answer for prostate cancer screening. Guidelines can vary, and the decision often involves weighing the potential benefits and risks of testing. A healthcare provider can explain these nuances, helping you choose the path that is right for you based on your age, health status, and personal preferences. Ultimately, the most powerful step any man can take is to be proactive about his health. Do not wait for symptoms to appear. Schedule regular checkups with your doctor and make prostate health a topic of conversation. Ask about screening options, including the PSA test and DRE, and discuss whether they are appropriate for you. Early detection saves lives and significantly improves treatment outcomes. By understanding the risks, making healthy lifestyle choices, and engaging in regular medical consultations, you can take meaningful action to protect yourself from this silent threat. Your health is your most valuable asset. Take charge of it today for a healthier tomorrow.